contribution, and thank you so much. Okay. We have one last lecture, but Dr. Ayman has a commitment and has to leave us now. Thank you so much.
Good afternoon.
Our last lecture is a recorded lecture. Unfortunately, Dr. Ahmed Samir will not be able to join us today. Dr. Ahmed Samir is a professor of radiology and leading cardiac imager and an expert in MRI, cardiac, CT cardiac, and AI in cardiology. So it's about when AI meets cardiac imaging. Can you please start the lecture?
Good afternoon, everyone. I'm Dr. Ahmed Samir, Professor of Radiology and specialized in cardiovascular imaging. And it's really my pleasure to be with you this afternoon speaking about AI and how it can help in cardiovascular imaging. AI is already around us everywhere. Face recognition in banking security, Google Maps, searching, voice recognition. And that's what we call the first contact, and it is helping a lot. It has some drawbacks, like information overload and fake news and addiction and others. Regarding radiology, already AI is in our machines, in all machines. For example, in CT machine, it is helping us, and it is already embedded in machine 10 years ago, helping us to decrease the amount of radiation, near 70% in some machines, which is great. And this is using a combination of deep learning and AI. In CT machine also, AI can help in prioritization of emergency cases, like in this recent publication in Radiology, showing that AI can help us to predict and tell us the important cases, like cases of pulmonary embolism, so that radiology start by reporting this category of cases. So we have a problem in 2024. Medical imaging is challenged. Why? Because we have a 2.5 increase in workload for radiologists. So we are in need of more radiologists. We have a global shortage in radiologists. 2/3 of the world population do not have an access to radiologists. So we suppose that AI can help us. And this is what I want to show you by this lecture. Radiology needs AI, and radiology is really a source of data for AI. Research statistics show that more than 80% of medical data comes from medical imaging, and more than 70% of clinical diagnosis requires medical imaging. So coming for cardiovascular imaging. As you all know, cardiovascular diseases are still one of the most important causes of mortality worldwide. It is the #1 cause of mortality. And here comes the role of AI to help in CT and MRI and other radiological procedure to accelerate the process of diagnosis. Regarding CT, we had a great evolution as far as regard CT cardiac imaging, especially for coronaries. In 2010 and 4 years before, we were mainly focusing in coronary CT imaging on coronary anatomy. 2016 and going forward, we are more focusing now on coronary physiology and the flow within the coronary, what we call CT-FFR, CT fractional flow reserve. In 2023 and 2024, now we are focusing on coronary physiology and adding AI to help us in CT-FFR, and also AI is helping us in better characterization of type of plaques and identification of what we call vulnerable plaques. This is the evolution. And here comes the the role of AI. It can help us, for example, in better detection of calcification in a more rapid way along the course of coronaries, in better assessment of RV and RV function, segmentation, in identification of coronary artery stenosis. I will be showing you some examples. Here, for example, in this Korean study published 3 years ago, AI is helping in automatic identification of coronary artery calcium in few seconds, less than 1 minute, 57 seconds. The machine can tell us exactly the amount of calcium that is present around coronaries. In this other software, publication published 2 years ago in computers in biology and medicine, we are capable of automatic segmentation either in CT or MRI, getting the function of the left ventricle and getting the function of the right ventricle, which is a very long process for us usually on workstation. And here AI can make it in less than 2 seconds. Really amazing. In this publication in the Egyptian Journal of Radiology, we made a study and we used AI to help us in identification of the amount of epicardial adipose tissue. And the more it increases, the more there is a risk of coronary artery disease. And it is related to some factors related to coronary atherosclerosis. These other studies published in Elsevier Journal of Cardiovascular Computed Tomography 3 years ago, in a big study close to Clarify study, AI was enabled to analyze coronary CT images, and it was really found to be able to rapidly quantify the stenosis and the CAD-RADS, which is amount of stenosis present in coronaries. And as you can see in this other study, when we compare what the human being was able to get, the radiologist was given to get, and the findings with AI, as you can see here, we can see that the numbers are really very near to each other, which is amazing. So AI can really help in assessment of the degree of coronary artery stenosis. It can also help us in assessment of the pericoronary adipose tissue, which is a very hot topic nowadays, as you can see in this publication last year. So by analyzing the amount of fat and the degree of inflammation, we can predict more and more the type of plaque that we have in the coronary artery, and using this information combined with AI, we can write a more accurate report and be giving more physiological information combined to anatomical information as far as regard the degree and the risk of stenosis that can happen in a coronary artery. AI, or what we call deep learning CT plaque segmentation, as you can see in these two papers published in 2021 and 2022, can help us having a roadmap, or can having a sort of full image planning the whole coronary, the LED here, and the right coronary, and the LCX. And we can see in one click, you can see where is the site of stenosis. Like, for example, in this case, we have the AI is telling us you have a significant lesion or a borderline lesion in the proximal portion of LED. In the world of CT, of coronary CT imaging, we have some cases which are difficult to diagnose, what we call the borderline stenotic lesion, where we are speaking of a stenotic lesion between 50 and 70%. And in this case, we can go for invasive technique like FFR, but this is an invasive long technique, very long technique. Now, CT FFR is helping us to characterize this borderline lesion and tell us if there is enough flow after the site of this borderline lesion. Okay, so we have an idea about hemodynamics after the site of borderline stenotic lesion. FFR. Deep learning AI can also help us have information about the contractility of the myocardium while doing cases of cardiac MRI. So, and it can give us an idea about the prognosis of a patient as far as regard the function of his left ventricle. When we look at this very important paper published by David Blumke, very big name in cardiac imaging in States, looking at 2040, he's telling us coronary CT angiography will be totally automated using AI, of course. Photon counting CT will replace conventional CT, so we can predict using AI what will be the evolution of CT machine. Next generation cardiac CT will become more like MRI. Next generation cardiac MRI will become more like CT. So here is the future. David Blumke is trying to tell us how the future will be. But AI can have some fallacies. It can be doing some mistakes, like for example, overcounting the amount of calcium. Why? Because of some errors, like for example, here taking the rips for calcium and giving us a false number, taking a pulmonary nodule for calcium and giving us a full number. So we have to revise our data. ChatGPT, you all know ChatGPT. It can help us in reporting and can help us in writing a nice report. But again, there are a lot of fallacies. You have to revise. You cannot depend on ChatGPT. Hey, again, human factor and radiology must be here. There is no doubt. A lot of errors were found in ChatGPT. Take care. And all companies are fighting together to give us the best from AI. Bard AI from Google, Alphabet before, Microsoft is trying another software. A lot of companies are fighting together to give us best AI application, but still we have a lot of problems and we must take care. And this bring us, to what we call the second contact social media with AI 2023. And here AI development is going very fast, what we call the generative large language multimodal, and it's going so fast that it can help, of course, give us more information about images, predict more data about functional MRI, for example, and combining DNA with images and combining different sounds with our images. But it can become very dangerous. It can be even dangerous for humanity. And it has a lot of drawbacks, like reality collapse, faking everything, alpha pasteurization, biology automation, automated lobbying. So we have to stop and control this very rapid progress of AI. And here is what very big names like Geoffrey Hinton, he's called the father of AI, and he was in Google and he left them in 2023, and Elon Musk and Stephen Wozniak, which is the true Apple co-founder. Okay, they are all asking to slow down the public deployment of generative large language model, to give more time. We need more time to analyze this AI very rapid progress. So to sum up this lecture, AI needs more time for testing and trial. There is no doubt that AI will help a lot of medicine, especially we are speaking of precision medicine. AI must be used by healthcare professionals and radiologists, and they must not fear AI. AI is here to stay, and AI is sure will help a lot in cardiovascular imaging application, as we have seen in this lecture. And just to finish, this is an example of an AI Copilot created images. I just ask Copilot, which is an AI software on Edge Microsoft to give me an image of cardiac CT. And this is what he gave me. A bizarre machine that doesn't exist, a patient sitting in a CT, which is totally impossible. And this was just to finish my lecture and to show you that AI will help a lot, but we have to be here, take care, analyze everything that is given to us through AI. Thank you very, very, very much. It was my pleasure to be with you. And goodbye.
We would like to thank